Welcome back, everyone, to the Moms Like Me podcast powered by Support Now. It is not October. It's actually April. It's April 27th. I don't know when this episode will be officially uploaded, but in my mind, it's Breast Cancer Awareness Month, which I've seen this talked about pretty frequently about how, why do we only attach breast cancer awareness to 1 month when it is such a prevalent cancer for not just women, for men as well? And it should be talked about more. Awareness should be there more. And so I'm super excited to bring on our guest today who has a lot of experience in not necessarily breast cancer specifically, but the ways to prevent it and ways to know and to understand your options around understanding how breast cancer works for some women. So Aliza Friedlander is my guest today. She's been a friend of the company forever. And as we were catching up on her personal life, she's a mom of 3. She's been through quite the health journey over the last 4 or 5 years. And as she was sharing more, it became immediately obvious that this was a story and a journey that needed to be shared on the podcast, not just for her, but for our listeners who should be aware of the different challenges and frankly opportunities to know your body and know what options are available to you. So Aliza, thank you so much for being here today. I appreciate it.
Thank you. And thank you for having me. And yeah, it is not Breast Cancer Awareness Month, but it is April, although this will probably air not in April. And April is actually, I'm going to get the name wrong, but early cancer, it's screening and prevention month. So
perfect. We planned it that way, of course.
Exactly.
And just like Aliza planned to wear pink today, she claims that it wasn't because we're talking about breast cancer. No, it was just like the thing she wanted to do. So that's also your cue, listeners, to go to our YouTube channel so you can actually watch the episode with video as well. So Aliza, again, breast cancer, it's something that we hear about a lot. I would say that what's less familiar, although getting a little bit more attention, is the BRCA gene. But before we get into the science, talk to us a little bit more, talk to me a little bit more about your family history here. Because I think that while genetics can oftentimes play a role, doesn't always, but it can often kind of set off a series of decisions. So I would love for you to begin to share a little bit more about your family history here, and then we'll go from there.
Yeah. So like you said, I have not had breast cancer. Actually, I don't know if you mentioned that, but I haven't had breast cancer. I am what we call nowadays a previvor. So I have done surgeries to prevent my risk and lower my chances of getting breast cancer and actually ovarian cancer too. And my family history is, I think, a bit different than maybe what you would think about if you are looking at somebody who has this deep family history of breast cancer. So back in 2013, my grandmother was diagnosed with a second bout of breast cancer. She was postmenopausal. She was kind of in that bucket of, oh, of course you're going to get breast cancer because you're at this age, which is a narrative and a story that we have out there, that it's just kind of inevitable that if you have boobs, you're going to get breast cancer.
Yeah.
Which is, the first thing that maybe we should reconsider or think about. But so she was going through this in 2013, simultaneously with when Angelina Jolie had come out with a big article in all of the magazines about what she was doing preventatively. And she came out with this story that she had done a prophylactic bilateral mastectomy. She has the BRCA genetic mutation, and this was her way of preventing cancer. I guess, as the story goes, or as it's told to me, they had a new spit test for genetic testing that they offered to my grandmother while she was going through treatment. So she was like, okay, I guess I'll do it. It was just really a basic spit in a tube, send it off. And it came back and she was positive for the BRCA1 genetic mutation.
And how old was she?
Oh, so it was 2013. And let me do the math. She ended up passing away in 2019 at 87. So 13.
Okay. So about 80 years old, 81 years old.
Yeah. Old. And it was her second bout. So this was her second time doing it, which I think is why they had offered her maybe the genetic testing, although I'm not sure. But her first time, she was also on the older side. We did not have a history of early onset breast cancer or early onset ovarian cancer, nothing. So when this gene came back as positive, honestly, nobody really even knew what that meant. And I do also want to mention that everybody actually does have a BRCA1 and BRCA2 gene. It's the mutation that is positive. So I have a BRCA1 genetic mutation, not just the BRCA1 gene, because we all as people have the BRCA1 and 2 gene. So she was BRCA1 positive, which means she had a genetic mutation on that BRCA gene. And basically, things kind of snowballed from there. None of us, like I said, really knew what that meant. However, we knew that it meant that it increased your risk of breast cancer, it increased your risk of ovarian cancer. And so she then had to come and tell all of us, like, okay, we have this genetic mutation, you need to get tested. Or genetic testing. Again, this was back in 2013 when we were just starting to hear what this meant. And this was
I think I want to pause you there because I think that's really important. Like, I personally feel like the word BRCA or BRCA gene has become far more commonplace over the last 5 to 7 years. It sounds like it wasn't something you were familiar with until she got that diagnosis, but I'm sure you've also seen the uptick in just general awareness talking about this since then.
Yeah, so from 2013 to where we are now in 2026, it is a drastic difference, I think. I feel like BRCA genetic mutations, and you hear about genetic mutations and you automatically think BRCA. And so it is, I think, much more commonplace now.
Yeah.
Back then, nobody knew about it. Now, I will say I've talked to doctors and I've talked to researchers, and when I tell this story to them, their response is, oh, well, we've known about this genetic mutation for 25 plus years we've been studying it. I'm like, that doesn't really help me as a layperson, but okay, I'm really glad that you've known about it. So the only frame of reference that we really had, and that I even remember really having, was this story of Angelina Jolie. And they do call it the Angelina Jolie effect, where now that she had talked about this, it kind of then became mainstream, which, I think we see all the time, don't we? You see celebrities or somebody who's not, maybe what you would think of as an expert telling their story or sharing what's going on with them. And then people start diving deep and digging into it and being like, oh, if this is what happens to her, then maybe this is what would happen to me. And so that, I think, was a catalyst, in my opinion, for awareness around this genetic mutation. And also for my family, I think it was a catalyst it was May of 2013 when she told her story. And it was also May of 2013 when my grandmother was going through all of this. So the two worlds really collided. And my grandmother was like, you need to get tested. But again, none of us really knew what that meant. Truly had no idea. I know I had no idea. I was young. I had not had kids. I was in my 20s. I was newly married. I had just gotten married in 2011. And the way that you got tested, even though I did say it was a simple spit test and you do just spit in a tube, at that point, there weren't a lot of labs that were testing it and giving the results. So my mom and my aunt and my sister all did get tested. And they did a spit test, but then you had to send it off, I remember, to this secret lab in California that was one of the only ones that was doing the testing. And it took 8 weeks to get the results back. And you couldn't really tell anybody because at that point, it was still grounds to deny life insurance, which as somebody who was in her early 20s, I did not have life insurance. Yeah. And once you then found out, there was really nothing to do except for surveillance protocols or surgeries. So my aunt, my mom, and my sister, and my uncle actually all did get tested. My aunt, my mom, and my sister were all positive. Wow. And my mom, in December 2013, did do the gynecological surgeries, but she was also older and postmenopausal. And so she did the hysterectomy, oophorectomy, all of that side of things. My sister, who's younger than me, got tested, and she decided to go through the surveillance protocol. So every 6 months, do an MRI with contrast or mammogram, and then transvaginal ultrasounds. And me, who already had severe health-related anxieties, I do not do well with illness, germs, scared of death, all of that stuff, already severe anxiety around health, actually decided to not get tested. And this was based, again, on my lived experience and what I was seeing with my family, which we had no history of early onset breast cancer or ovarian cancer, and also conversations with my doctors, with genetic counselors. I did a full genetic counselor conversation. I did not do the testing. And we kind of came up with a game plan of these are sort of the steps of what you could do. And based on what you're telling me about your family history, based on what we're seeing, everybody felt very comfortable with me sort of living my life and going about things in this way. Now, I will tell you, it is, I don't think, the norm, in the sense that I do remember calling an organization that was one of the few at the time who was involved with, genetics and high risk and BRCA. And I got somebody on the phone and I said, this is in my family. We have the BRCA1 genetic mutation. I do not know what it is. And her response was, well, of course you're going to get tested and then you're going to have a prophylactic bilateral mastectomy if you're positive, right? And I was like, okay, I'm sorry. Like, backtrack for a second.
Yeah.
What? That wasn't even on my radar. Like, my grandmother, who had 2 bouts of breast cancer, never had a mastectomy. She had 2 lumpectomies. My mother had never. So I was like, no.
So your decision at that point, it was driven by, my sense is that it was driven by your desire to protect your mental health, right? Like the psychology of knowing. And my question is what you were actually thinking, in the sense of, okay, I'm not going to go do these things because I know it's not good for my mental health. But were you also in a way accepting that you probably had it, or were you kind of in this state of denial? Like, that part I'm trying to get clear.
It's 50-50. It's a 50-50 shot that you have it. So it could have gone either way. I personally lived for 10 years until I did get tested, with the assumption that I was positive until proven negative. Now, for me, that meant it was kind of always in the back of my head. Whenever I had my annual appointments with my gynecologist, I would talk about it. Every couple of years, I did check in with a genetic counselor to sort of see where things stood, but I never got tested. And my plan was always to live my life, go about my life, have my kids, breastfeed if I could. That was something that I wanted to try. I wasn't married to the idea, but I didn't want to have no option. I didn't want to do anything prior to having children. I didn't have kids. I didn't have life insurance. Like, there were a lot of ducks in a row that I needed to get in order to, I think, feel comfortable getting tested.
Yeah.
And so all of those things, combined with the fact that there was no history of early onset breast cancer in my family, sort of felt to me like, why am I gonna find out? And why am I gonna sit here? And like, my 2 options felt like I could worry and go through constant surveillance and, do a lot of false negatives, false positives, whatever that looked like for me for surveillance, which would totally fuck up my mental health because I was already anxious about that. Or I could look at my story and my family's history and my lived experiences and what we had and sort of, not blindly and naively continue forward, but not get all of the information.
I think this is part of why I think your story is so interesting. Like, I do think that this is you said this earlier, like, not necessarily the norm. It's not like what maybe most people would assume is like the next best step. And at the same time, I respect and can appreciate you were in your 20s. You had just gotten married. There were so many important years ahead of you where, again, if you want to have a baby, like, what's the best way to have a baby is to think positively and to think like you have to be in a certain headspace. That obviously science doesn't require just a headspace to make things happen, but I can appreciate that you at least took a step back and said to yourself comprehensively, in order for me to be happy and to kind of bridge into this next stage, I know I'm going to need to prioritize the things I want to do before I jump into all of these potential pathways that could introduce a whole bunch more anxiety on me that you weren't ready to kind of have that sprung on you. So I think it's, again, I appreciate that you realize that it's not necessarily the most traditional route. And I also appreciate the fact that you just chose to like change the lens in which you viewed it. And again, it sounds like 10 years later, you did go back, correct? And so tell me more about like when you knew, okay, now I'm ready to look into this further.
Yeah. And honestly, I would even go further and say, not only is it not the typical path that you would think of or listen, I would say it's probably frowned upon in most circles. Most people have this idea, and I agree with it, that knowledge is power. And I do think that knowledge is power. And I think that knowing and being proactive and gathering the information that can impact a decision is super important. But I think that decision doesn't necessarily go one way or another. So I did gather all of my information. I did not make this decision blindly or naively. I made it with all of the information that I thought I had at the time,
Yep.
based on my lived experience, based on my family history, based on what my trusted doctors were saying to me. They were in agreement. The genetic counselor was like, okay, we're looking at all of this. I think that this is an okay path for you to go down. We understand why you're doing it. For me, at that point in my life, knowledge felt like paralyzing almost, because there were not many choices for me. It's either know that you have this genetic mutation and live with this increased risk of breast cancer or ovarian cancer, which I was already living with because I knew it was a 50-50, or continue to monitor, continue to gather the information, and go about my life in a way that felt good for me. And again, my plan was always to find out. It was never to not find out, because I need to find out for my kids. But also back then, they weren't doing IVF to remove genetic mutations. There wasn't anything except for a drastic surgery that was basically like amputation of body parts, or kind of sitting on it during surveillance. And I treated myself, like I said, positive until proven negative.
Right.
And I was able to breastfeed. I had my 3 children. I went through everything that I had wanted to do. And then in 2023, our family history drastically changed. And my sister, who had gone tested and gone through all of the surveillance and done all of the protocols and actually made the opposite choice of me as my younger sister, and she's my younger sister, she was diagnosed with breast cancer. So suddenly in October 2023, which was 10 years later, our family history drastically changed, and my story and my experience drastically changed. And so I went from having no family history or family members with early onset breast cancer to having my sister be diagnosed with breast cancer at 32. I was at the end of my breastfeeding journey with my 3rd daughter. And at that point, my doctors and myself were like, you can't sit on this anymore. You now need to get tested. And if you are positive, you have to really think of what you are going to do as your next steps. So
Yes.
I did get tested. I got tested in December of 2023. And in March of 2024, I did go through with the prophylactic bilateral mastectomy and reconstruction. So I did do the drastic surgery. So I ended up doing the very thing I feared most, and the very thing that organization had said, well, of course you're going to get this preventative surgery. I just did it a little bit later. And for me, that worked. Now, knowing what I know now, do I wish I had made a different decision back then? Sometimes yes, and also sometimes no, because hindsight's 2020. At the end of the day, I did what was best for my mental health and my well-being, while also making sure that I kept my options open. And throughout those 10 years, like I said, I didn't pretend it didn't exist. I didn't shut it into a box and be like, oh, this isn't a possibility. Even when I got my IUD between my 2nd and 3rd daughter, my gynecologist purposefully gave me an IUD with no hormones, because if I had made the decision, or if something had happened that during that period of time I wanted to get tested and I found out I was BRCA positive, right, then I could go on some of the medicines or whatever it was, and I wouldn't have to switch out the IUD. So I made a lot of decisions under this umbrella of, you probably have this genetic mutation. I just wasn't ready to have to do a drastic surgery. And
So first question.
Yeah.
How's your sister?
My sister's doing great. Thank you for asking. She is, thank God, in remission, and she's doing great. I think there is, though, there's a before and after for her and for me and for everybody who's ever involved in a diagnosis of any kind, or something where, your story shifts and changes.
Yeah.
So there's that before and after. And what's happened after has been, it's hard. It's not
Yeah.
easy, and you never go back. You never go back to who you were before.
Right. Yeah, I think that's one of the most common misperceptions is that like even when you're quote cancer free, you've rung the bell, all of these things that suddenly that you can just go back to the life you once had, and that's just not true. You've evolved completely. And I think once you see the C word, you can't unsee it and you just know it's a thing. It's not surprising.
Yeah.
And I think it's something that, it's interesting. You said earlier like the Angelina Jolie effect, which I certainly agree with. And I also think so much of the BRCA gene and cancer awareness, and really a lot of medical diagnoses that we talk about today, are getting more attention because of social media. I mean, girls and women everywhere are being open with symptoms that they felt that triggered certain diagnoses and treatments and options. So I think gone are the days where we expect like a top down from a doctor's of like, and here are the things you're going to do. And because I think so many people are listening to people online that see themselves, they look like me, they're a mom or they're a certain age, and they hear their medical journey and they're taking that into account and then raising it with their doctors, which then creates this like flywheel of making doctors think, oh, well, maybe I should be more proactive with my patients about getting mammograms or things like that. So I think all of those things are true. What I'm curious about is the decision to go through with your surgeries. What was your headspace at that point? Were you in this place of like, okay, I knew this was possible, we're going to do this, I'm good? Or was it much more layered and nuanced than that?
So I would say each surgery that I've had, I've been in a different headspace. So for the mastectomy, I did that so fast, honestly. I found out in December 2023 that I had the BRCA1 genetic mutation. In January, I had my diagnostic MRI to get in with a breast surgeon. In March, I got in with the surgeon and scheduled my appointment for 2 weeks later on the spot.
Wow.
So within 8 weeks, I went from finding out I was positive to having my procedure. I happen to know my doctor. I happen to have a lot of friends in this space because I have talked about this at times. This isn't the first time I had spoken about this. And I just, for me, couldn't sit on it because I think if I had sat on it, I would have continued to just push it off and been like, okay, well, maybe I can just do for surveillance, or maybe there are other things. And for me at that point, there wasn't any other option than surgery because I was seeing what my sister was going through. And I kind of was like, well, I'm probably either going to need to have this surgery now and I can do it without having to do anything else that comes along with a cancer diagnosis, or I'll have to do it at some point and then I have to do everything else that comes along with a cancer diagnosis, whether it's chemo, radiation, all the other things. So I did it like 1, 2, 3 and did not process it and did not think about it and kind of just was like, head down, here we go. I had 3 children. My youngest was born at the end of December. She turned a year December 22nd, 2023. So she was 14 months.
Yeah.
And I did everything in a way that it was as fast as I could. So I got the surgery. I did not do any type of customization for my breasts or anything because I wanted to go direct to implant, which was actually something that I didn't know was a possibility. So I was able to skip the expanders phase because if you're doing it preventatively, as long as everything kind of pans out and you have to go through like this checklist of things that you need to be eligible for, you can do the surgery together. So my first half, I had an 8-hour surgery where I had the first half was the breast surgeon and the second half was the reconstruction surgeon. And it was done within one time because I wanted as few restrictions as possible. I couldn't go through multiple 6-week lifting restrictions. I had a baby who was in a crib.
Right.
I had to be able to put her in there. So
Interesting.
I opted to actually get rid of my nipples because after breastfeeding 3 children, if I had just done the direct to implant, the nipples would have been set. They just wouldn't have looked right. So I was like, I care less about having nipples, more about having one surgery. So I did everything very like pragmatically as opposed to emotionally. And I think now, even now, I'm still like retrospectively processing everything that I've been through. And I still do downplay it. I'm like, oh, okay, this is like, I did it and it's done and all that. But it's not. It's a huge surgery. I mean, I have no feeling in my chest. I have never thought more about my boobs and my chest than I have in these last 2+ years. Like, I feel everything. I like have weird twinges. It's just like a huge procedure. And also, I didn't think that I had another choice. Now, I do know now that I did maybe there are other things that I could have looked at or done. And there are some clinical trials that are out there for people who are high risk, who have genetic mutations, some cancer vaccine clinical trials, just a lot of modernized medicine and treatments that aren't standard of care as of yet, but I'm hopeful will be standard of care for my children and my daughters if they do have this mutation. But yeah, so that's sort of where I was with that surgery.
Yeah.
I did have the prophylactic complete hysterectomy and oophorectomy February of this year, so February 2026. And that one was much more difficult for me than the breast one, actually. And that one, the processing and the mental side of things for that was much harder for me than doing the boob one. Now, the boob one was a harder physical recovery, but this one, I mean, as some of my friends who've done it kind of describe, it's like getting rid of like the brain of your body, essentially, because I put myself into surgically induced menopause at 38 years old and have made myself infertile, which I'm blessed to have my 3 children. And my husband and I were done with building our family. However, this is such a final, like, end to it. And I knew this was coming at some point, and I had a lot more time before the surgery to kind of just continuously be like, okay, I have to do this, I have to do this, I have to do this, and push it off, push it off, push it off until I was like, I just need to get this done because I can't push it off I just can't think about it mentally anymore. So that one was in terms of processing and going through it.
Well, I also wonder if because you said like with the mastectomy, double mastectomy, like it's just like full throttle, go, go, go. You're not having time to think. But by the time you actually process what happened, it was time for everything else. So it was almost like everything was converging all at once. So it's like, I almost wonder, it's like, it's not that you didn't process the mastectomy differently than the hysterectomy and everything else. It's that like, it would just all converge. And like, let's not forget, you know, obviously your daughter's 3 now, but like up until, 2, you're still considered postpartum. So you've got a lot of things going on in your body, and your body's trying to make sense of like, wait, I'm supposed to be hormonal and crazy, et cetera. And now you're taking these things out of me, and I'm trying to like reevaluate, like your body is trying to reevaluate, like, who are you? What am I supposed to do? I mean, it's not surprising to me. It's sad. It's so sad that you and so many have to go through with it. But it's not surprising because that's how we were built. Like we were built to have these certain engines and emotions and responses to certain things. My question is, what have you done, or what are you trying to do to like not overcome, but like really come to make this like to meet the moment? Because you're not going to reverse it. This is who you're going to be the rest of your life. So what have you done? What do you encourage others to do that find themselves in a place where you're effectively, you're 38 years old, but your body functions like a grandma? I mean, in some ways.
Yeah. So I think that there's 2 parts to that question. I think there's the first part is like what I'm doing physically, and then what I'm doing mentally, I think, to balance them. I am on hormone replacement therapy. Now, I do want to say very clearly that I am on hormone replacement therapy because I've done this as a preventative measure. So there are different, and I'm not a doctor. So again, everything that I'm sharing in this, I just want people to know that this is my lived experience. Yep. This is what I've learned based on my research and from my doctors, but I am not a physician. I am just like you. I'm just like every other mom or regular person or regular lay woman listening to this, trying to navigate a system that I am not an expert in, but have now become almost an expert because of my experiences. So my understanding is that because I did this preventatively, I was eligible and am eligible for hormone replacement therapy. And because I did the hysterectomy post mastectomy. So that's also why they have you go in the order that I did, is they want you to remove the breasts and breast tissue before you then do the gynecological stuff so that you can be eligible, I think, for hormone replacement therapy.
Interesting.
And this is all really new as well. And this is a gray space where I feel like everybody's still learning because we did just have this black box removal of hormone replacement therapy and this shift in culture of what we thought was okay and what we now know is okay and a change. So I've talked to my doctors a lot about this. I was actually really nervous to do hormone replacement therapy. I didn't know if I wanted to because even though I believe in science and I believe in medicine and I trust my doctors, and it's hard not to hear the things that go on in the background and the conversations and the changes. And you never really know. And we do live in this gray area, even though it feels like we're not allowed to. And things can change. What you knew 10 years ago can be different. And we're allowed to iterate. We're allowed to have science modernize and change. And that doesn't mean that it was wrong back then. Or that it wasn't wrong.
Or that things evolve. I mean, like things like, again, mutations mutate and responses. And like, there's only so much time you have to study the impact of a decision you made today on what it's going to look like a couple decades from now.
Yeah. And so I work very closely with my doctors, and she's very upfront that as they don't learn about this in medical school either. And this is, everybody's kind of learning as we go. However, she was very adamant, my particular surgeon, that at my age, as a preventative measure, she would not have done a complete hysterectomy and oophorectomy if I wasn't willing to go on hormone replacement therapy at this stage, even with the BRCA genetic mutation. So looking at those risk rewards of what early menopause does to you as an older person versus like the chances of me getting ovarian cancer. And for me, not that I'm a drastic person, because clearly I'm not. I didn't get tested for 10 years. But for me at this phase, I wanted to get everything out that I could. And I think that the risk for me of being on hormone replacement therapy is significantly less than the reward of removing my organs and doing hormone replacement therapy. So that's what I'm on physically. And it's been great. I mean, I don't have any symptoms of menopause. Yeah. I was on progesterone as well. Now I'm just on the estrogen patch. That made me feel early pregnancy. It made me like anxious. I was having symptoms towards that. So she took me off of that, and now I'm just on the patch. And I've been completely fine. I have some issues with word retrieval, I think. But I don't know if that's early menopause, or just aging and mom of 3, but I do find that. And then mentally, what I'm doing is this right here, talking about it, sharing, making sure that people can hear my story. I feel super uncomfortable doing it. I am a communications expert and former morning show producer by trade, yet have never felt comfortable sharing my own story or being in front of things. I think it's so much easier being behind the person doing it and the producer in the room. And so for me, part of how I'm healing mentally is talking about it. I always have loved sharing stories. I've always loved talking and sharing other people's stories. And so now that's what I want to do. I think I want people to know that your experience is your expertise, and that there is one person out there who's waiting for you to share your story. There's one person out there who is hoping that you are on the other end of something to listen or hear what it is they have to say. I think I'm trying to just ask questions, be a support if that's what somebody wants. And if it's not what they want, then that's not what they want. Everybody has to navigate in their own way. So I guess that's what I'm trying to do. And then I'm also leaning into, I got super involved with an organization that is now part of Parker Institute for Cancer Immunotherapy. And I was really knee deep in moving forward cancer vaccine research. I had met a former Today Show correspondent who was talking about this simultaneously with me going through my prophylactic mastectomy. And so I worked on that type of research. I've gotten very involved and knowledgeable on clinical trials. new options, different options, advocating for myself or for others, research. I'm not a doctor, but
You might as well be.
I play one on TV.
I mean, listen, I hear this often. It's like, don't put anything past a mom who has a reason to live, who has young children. It's like, yeah, you may not have your PhD, like you may not have all the credentials, but you've done your research, which means that you're dangerous. And I think where I want to kind of end today is there's so many layers to your story, and I think it's so important what you're doing. It is so important that you tell this part of the story. So often you hear someone has the BRCA gene or someone has breast cancer, and then they have cancer, they go through chemo, radiation, etc., and then they do all of this, the hysterectomy. What you're doing is calling attention to the fact that there is a different way of looking at it if you know that you're probably likely to have this mutation, and there's trade-offs along the way. And by bringing this to light, like your story will help one person. Because I think if there's something that I've learned over the last couple of years, even with support now, is you never know what one person might be going through. Your story could be the unlock for somebody else who has these fears in the back of their mind that are wrestling with very similar decision points that you had both in your 20s and in your 30s, that just needs the encouragement to say, I'm going to press my doctor on this, or I'm going to ask another question, or I'm going to move forward with this, or I'm going to wait, right? You never know. And I think that my favorite part about this podcast is highlighting the extraordinary, ordinary moms, because that is how, that is the world that we live in. That's how we get better, is when these extraordinary, ordinary moms share their stories, because those stories become treatments. They become like the way that we shape and change the world. And I know that sounds really big, but it really only takes one person. And so my hope for this episode is that it does reach at least one person that says, maybe I do need to see if I have this mutation, or maybe it is time for me to, go from surveillance mode to a different way of thinking, whatever that might be. This cancer in particular is so commonplace, but we're still at the very beginning of really understanding what we can do to implement real change for women. And I am just so grateful that you would be willing to share your story with us. So thank you.
Yeah, well, and thank you for having me. And I think I just wanted to add on to that. And I know we covered a lot, but I think, like you said, thinking of things in a way that work for you, being willing to advocate for yourself and asking. I think that we are conditioned to fix things. We are conditioned to make these decisions and not always given the space to say, okay, I know what maybe the end point has to be. I know what I have here, but there's a pathway in between that may not mean I'm quite at the end point that I'm going to end up at. And that's okay. There is not a one size fits all. And recommendations are recommendations. So I would just say, even if you don't have a family history, if you have no genetic mutations in your family, no cancers, it's still worth asking doctors or finding out, like, should I do genetic testing? Are you sure that I shouldn't have a mammogram at a younger age, or whatever it is, or surveillance of any kind? I think, and then trusting the people that you're asking and coming up with these game plans. And then the last thing is, at least for me, I find that sometimes it's easier to talk to people who aren't emotionally wrapped up in the situation, because not everybody is going to make the decision that you want to make. And at the end of the day, it's going to be based on what you need to do. And I noticed that with my sister. And when I tried to be a support for her and I wanted her to do things the way that I would have done it. And, you can only give so much information when you're emotionally wrapped up or tied to something so closely. It can be hard to see the different paths or the bigger picture. So if there is anybody listening, like, I'm on Instagram. I don't share a ton, but I'm going to try and start. You can put my email and my anything in the show notes, Jordan, but reach out. I'm happy to direct you if I can, help, talk, support. I think we are at the cusp with technology and where we are in this world of really changing the game for how we look at medicine. and becoming much more proactive instead of reactive. And I'm really, really excited about that and really hopeful that that's where it goes for my 3 daughters, because I do have 3 girls who have a 50-50 chance of having this.
Yeah.
And also, even if you're not a girl, men have 50-50 chance of having it too. So it is
Right.
gender neutral.
That's right. That's right. Aliza Friedlander, thank you so much for being here today. I'm very confident we'll be looking back in this episode saying, remember when you were a little bit nervous or shy and doing all these things? So let this be like the
coming out party.
Exactly.
Yeah.
But thank you. And we'll absolutely share your credentials and your contact information in the show notes. And I look forward to seeing where this journey takes you.
Thank you. And thank you for all you guys are doing and what you have with Support Now. You know, it's really, again, I saw with my sister and trying to organize all these different platforms and networks and stuff. I think it's a game changer to have something that is just like a one-stop shop and to take one thing off of people's brains as all of these things are spiraling. So thank you for what you guys are doing too at Support Now and making this your life's work, because it really does make a difference.
Thank you.